All right. Hello, everyone. My name is Tony Nahr, and I'd like to welcome you to Facebook Live nursing event for the Mayo Clinic. This is the Mayo Clinic's third Facebook Live event. Our first event focused on nursing jobs here at Mayo Clinic, and our second event was focused on developing that nurse-patient relationship and how we really foster a healing environment here at Mayo Clinic. Today, we're looking at going a little further with that and exploring the innovative nursing practices that we are taking on here at Mayo Clinic. First off, a little bit about myself. I've been a nurse here at Mayo Clinic for just over 20 years. I started as a nurse intern here through our Summer 3 program on a cardiac surgical PCU, Mary Bri 5 CNF. I also worked here as a nurse for several years in cardiac surgical care before moving on to work in trauma intensive care. I've then gone on to be a nurse leader here, first supporting our hyperbaric chamber and aerospace and hyperbaric practices, and now have come back to my initial nursing home. So I work as the manager of Mary Bri 5 CNF, the post-cardiac surgical PCU. And I got to tell you, the last 20 years has been an absolute pleasure to participate in Mayo Clinic's vision to transform healthcare to meet the needs of the patient through many complex and serious diseases. Our topic today is innovation in the Mayo Clinic. We're going to explore technology and practice innovation that allows Mayo Clinic nurses to boldly move forward through practice and meet the needs of our patients throughout the world. We'll discuss innovative technology and allow nurses to support patients no matter where they are, whether it's in the home, in the hospital, or in other hospitals across the nation. Joining us today for this discussion are two experts in the field. First, we have Bree Hammond. Bree has been a Mayo Clinic nurse for 18 years. She has worked in a variety of inpatient and outpatient clinical settings. Bree was a staff nurse and has the privilege of serving as nurse manager for Mayo Clinic's Enhanced Critical Care EICU program. Along with her passion for critical care, Bree is heavily invested in disrupting the norm to advance nursing practice. She's excited to be here today and share how technology has been instrumental in the EICU's development. Our second guest is Erica Rolland. Erica is currently one of the charge nurses at the Remote Patient Monitoring Center with our Center for Connected Care. She has also worked with this program for the past 3 years in a variety of other roles supporting our connected care mission. We're really looking forward to this discussion. Please feel free to send your questions and we will answer them as possible. The question link is in the bottom of the Facebook Live video feed, and we will get to those as we move forward. First off, like we said, there are multiple innovations going on at the Mayo Clinic. We're taking on the Lung in the Box program for lung transplants. We have new and innovative nursing practices going on in just about every unit. We are working to change the way that nurse staffing is done in the inpatient, the clinic, and multiple ambulatory settings. We've truly had the privilege of putting nurses in some very unique post-operative settings, as well as areas like the hyperbaric chamber and multiple different research venues. We're advancing technology, partnering with medical technology groups, moving forward how we do patient imaging, allowing nurses to work in research, development, and biomedical technology advancements. Bree, do you want to share a little bit with us about some of the advances or innovative things that led you to your current role? Okay, I'm not getting Bree right now. Erica, are you?
Oh, there we go. Sorry about that. Good old mute button. I'm struggling with technology while I'm talking about technology. That's great. Never thought that I would start my nursing career or end my nursing career, middle of my nursing career behind a keyboard. I had always envisioned myself at the bedside caring for patients. And since the advent of more telehealth programs that include nursing, we've been able to really change the way that nurses perform, the way that nurses assess patients. And I think that having a background in a variety of settings has really prepared me well for working in the EICU.
Excellent, thank you. And I'll point out one of those advancements that Mayo Clinic's been pushing as we work through this pandemic environment is the clinical safety of both of our patients and our coworkers. So you'll see Bree is working with other individuals, so does have a mask on to keep everyone safe as we go forward. Eric and I are in private spaces with good ventilation, and so we have the privilege of getting to speak to you without a mask today. Erica, can you tell us a little bit more about your initial foray here at the Mayo Clinic and some of those innovative opportunities that you've had?
Yeah, thanks, Tony. So I have worked at Mayo for about 19 years in a variety of settings. So started here at Mayo as a nursing student, moved through the internship program, and then have worked both in inpatient units, a general medical unit, and neonatal ICU, and then into more of some of the ambulatory settings, so telephone triage, and then remote patient monitoring. And one thing I've learned about innovation over these 19 years is that it happens in all settings. So Bree and I are here talking about very technology heavy and laden areas, but I have experienced innovation all the way through. And one of those reasons that we experience so much innovation at Mayo Clinic is because of the environment. It's because of the Mayo Clinic culture that everyone's voice is heard, everyone's voice is valued, especially nursing. So that doesn't happen if you are in a culture or an environment that you're not supported or that your voice isn't valued. So I can think of each of those settings really feeling heard and feeling the support to remain creative, innovative, and to really build on that everywhere that I've been at Mayo Clinic. So I think that is something that is very specific to Mayo, and we're very proud of. I would also say that innovation comes from nurses that know that we want to meet our patients' needs. Those needs of the patient are ever evolving, and we come from a place of creativity to both meet the patient's needs, meet our care team's needs, and that drives us to improve. So things that I've learned over those years, and some of those lessons are not easily learned, right? But we bring them with us through our career, and we build and we grow from that, both professionally and personally. And what I've learned is that even those hard lessons, there's something to learn there. So might not be easy, it might be pretty tough, and you're not seeing the lesson at the time, but there's always something to learn. Having that continuous learning mentality and continuous improvement will help you innovate no matter where you are. Maybe it's not your perfect job to start out with, but if you have kind of that creative and ever learning attitude, then you can innovate too. And then seeing the role of the nurse through a wider lens. So we can be very task focused sometimes, we can be very checklist oriented, but really trying to see the big picture and how we can meet the needs of our patient in whatever environment you're working in.
Sure. No, I like what you said there, Erica. I think one of the things that I have focused on in my career is being comfortable being uncomfortable. And I think that that really encompasses innovation, because it's never easy and it's never kind of what you thought it would be. So thanks for bringing that up. It's super important.
I do. I think embracing that change is so important. And we've all seen the ways that healthcare has had to adapt and embrace change. And I think another piece of that comes down to comfort in that safe space. And I know that's one of the things we've really worked hard on here, is to make Mayo Clinic and to make our nursing units professional assimilation units, where we bring in those new graduate nurses, we bring nurses, we teach them the profession of nursing, but that part of that professionalism is stepping outside of your comfort zone, getting away from taking on tasks and really growing the profession and growing the things that we can do as nurses to support patients as healthcare continues to adapt to the new needs of the nation. One of those technological aspects that kind of supports things is the internet and just the technology. And EICU really kind of speaks to technology, I think, as we talk about enhanced ICU, but also I think of it as, internet ICU, if you will. Can you tell us a little bit more about the EICU and what it is that your team does?
Sure. So the EICU, or Enhanced Critical Care Program, as we call it, has been live for about 7 years here at Mayo Clinic. We actually are kind of what we call a second set of eyes. We do remote monitoring of outlying ICUs and have expanded to PCUs and some general care settings. We use real-time physiologic data and physiological scoring and alerts that are popping up for us all the time to help detect deterioration. And we can also respond to anything emergent in the settings that we're monitoring. So I like to tell people we can do everything but touch the patient. We can do a pupillary assessment. We can write orders. Our physician partners can write orders, but really the nurses are the basis of that. We are the ones in front of that monitor responding to those alerts and then escalating them as need be. So as you can imagine, it's heavily tech focused. I'll show a quick snippet of my background if I can get it to work here. So you'll see behind me is our Mayo Enhanced Critical Care Core, or Center of Operations. We've got 2 nurses here and a provider 24/7. We also have APPs working with us. And we have 8 monitors in front of me, 2 computers, and they're continuously feeding data from a program called eCare. And then we also dig in a little bit deeper on those patients we're concerned about in Epic, or whichever site the local site uses, whichever EMR they use.
So Bree, you said there's 8 monitors. Does that mean each of those nurses is monitoring 8 patients at a time?
No, so that's a great question. Thanks, Tony. So there's 8 physical monitors. The industry standard for critical care nursing is 1 to about 40 patients. So typically our days are a little bit less than that. We're usually 25 to 30 patients that we're monitoring at a time. For our physicians, it's usually more like 1 to 60 to 100 patients at a time.
Okay.
And we're able to do that kind of population management with the software pulling and sniffing and looking for abnormal ranges.
And can you tell us a little bit more about how those monitors are hooked up? Like, are these patients that are in Rochester at Mayo Clinic or at all sorts of Mayo Clinic sites? Where are the patients located if you're not able to touch them physically?
Sure. They could be in really any setting in a hospital, unlike Erica, who her patients are a little bit different. So really in any hospital setting, we started out just monitoring 5 sites in the Mayo Clinic health systems. We've had some external clients, so patients that are in ICUs in Waycross, Georgia, patients are in ICUs in Massachusetts. But right now we're really focused on the MCHS sites, Mayo Clinic health systems, and also some internal focus where we're helping out some nurses in our progressive care units and even our general care units. It came in really handy with COVID that we were able to kind of fill up their bedside monitors. We were able to use audiovisual technology to camera into the room, talk to the nurses. They can see us, I can see them, and really form those relationships with the nurses to provide support.
Excellent. And Erica, with Connected Care, can you tell us a little bit more what remote patient monitoring is and what are some of the technological advances that allow that to happen for your nurses?
Yeah, absolutely. So I'll start with the Center for Connected Care here at Mayo Clinic. This is the very broad term for all of the technology. We house it all. We have many different product lines. So this is where we are providing that technology to support the patient remotely. So for instance, we can connect via, patient online services with patients, conduct e-visits. We support those asynchronous types of connection, synchronous, telemedicine video connections, and then remote patient monitoring is what I'll focus on today. That's the area that I work in. But our goal is to support the practices. So how can we make every practice, how can we supplement what they're already doing? How can we support them and drive their practice to higher levels? How can we collaborate with them and support patients in different ways remotely, sometimes in in their home environment with remote patient monitoring. Sometimes it is a referring provider from maybe a smaller hospital needing provider advice. We connect those providers together to support their needs. So we always call ourselves, the many irons in the fire department. We have lots going on all the time. Everyone is busy constantly, but it's a very exciting area. I will talk mostly about remote patient monitoring. I'm a registered nurse care coordinator within remote patient monitoring. And what we do is we send patients vital sign monitoring equipment to their homes. So we send them a kit. It has a blood pressure machine. It has a scale, a pulse oximeter, and a thermometer. And it all comes with a little tablet, like an iPad, that everything is very patient focused and user friendly. And we try to meet the patient where they're at. We try to support them in their home environment. It's really exciting because they usually haven't had that type of care, right? They're usually going into the clinic, they are hospitalized, and that's it. They may get a phone call, but this is really us being invited into the patient's home and supporting them. It can be very personal for them, and so we take that with a great sense of responsibility, but really transforming how we're able to support patients and monitor them remotely in this way. So we do, again, work with the patient's care team, with their primary care providers, with their specialty care providers, clinic nurses. There's a lot of collaboration in our area. One thing I'll also mention, as Tony had noted, I'm not wearing a mask. Our nurses, our remote monitoring nurses, also work virtually. So not only are we supporting patients virtually in their home environment, our nurses also work virtually and are not in the clinic environment. So just really thinking outside of the box here. The goals of the program include engaging patients in their own, chronic condition management, their healthcare, pulling them in with very visual and active ways of, they see their vital signs, they see what effect certain, lifestyle choices have on their vital signs. And a lot of times there are these aha moments for them. So that is a very rewarding part of our program. A lot of, goal setting with the patient and then working with their entire healthcare team to support everyone's needs and the patient. So the nurse, we get the vital sign data back and we are sitting watching their chart, their dashboard of vital signs. We're communicating with the care team, and then we call the patient over the phone to conduct nursing assessments. We can provide education, and then we can even initiate video visits with the patient as well. A lot of times we follow the patient's lead and what kind of support that they're needing.
Wow, Erica. So, it sounds like you've taken both the patient and the nurse out of the clinic setting. And so when you say remotely, does that mean your nurses are working from home, or are they going into small remote clinics that they work from, similar to the kind of technological hub that Bree was showing us?
Yeah, great question. And this is something that we were doing pre-COVID. So all of our nurses work from home mostly. We do have designated on-site locations should there be a meeting they need to attend or some reason to be on-site. So we have a little contingency planning there, but most of our nurses work from home. And as we saw with COVID this year, that was a huge bonus for us to not be on site and be contributing to any kind of spread or having risk of infection spread.
Excellent. And Erica, can you tell us how big is the remote patient monitoring team?
Yeah, so we have 11 nurses on our staff right now as permanent staff. We really shook things up in 2020 with the assistance that we needed with monitoring COVID patients. So took on a lot more staff during that time. During that time, we actually brought on 87 nurses through a period of about 6 months. Yep. So as you can imagine, us going from a staff of 11 to bringing on 87 nurses was quite an undertaking.
Wow.
So that is a huge undertaking. And so, I mean, almost 7 times as large a team. So can you tell me a little bit about what was it that you guys took on? I mean, like I said, we've been talking about technology, but what are some of those staffing challenges and what are some of those other changes that you made so that the nurses could really get the most out of the technology that you were putting in their hands and the patients could get the most out of the technology that you were putting in their hands?
Yeah, absolutely. So as I mentioned, luckily we were already doing a lot through technology and with virtual training and virtual communication and connection. So we had a lot of tools right at our disposal to use the virtual training method with the nurses that we were bringing on. So we were just completely floored with the staff that we got from inpatient units, from outpatient units, from all around Mayo. We got the best of the best. And, I think that speaks to Mayo and the nurses that we have here. They are ready to help where they are needed. We were an area directly supporting COVID patients, and just the ability for these nurses to take on a completely different job was amazing. I think, speaking back to your mentality of are you going to be a continuous learner? How do you deal with change management? This was a test for us. So we reaped so much benefit from training these nurses. We learned from them. They brought their expertise from their practices to us. They also improved our program. And then our nurses, our 11 nurses that we have on permanent staff, took such a role in training these nurses, mentoring them. We did some team nursing with our staffing model of just really supporting each other and making sure that we could be the best team that we could possibly be. We had nurses working constantly, and I can speak for my career, and I think my entire team's, that this will go down as one of the most things that we did in our career. This is why we are all in nursing, right?
Absolutely.
Absolutely, Erica. And Bree, what about yourself? So we heard Erica's team tremendously through COVID and some of the different staffing challenges she took on. Can you tell us a little bit more about how nurse staffing and just training changes when you're moving away from a bedside and teaching nurses to, I mean, I panic with 2 monitors, so I can't imagine having 8 monitors in front of me.
Yeah, thanks, Tony. I first thank you, Erica, and your team for the incredible agility that you showed. That I'm just floored by that still, because that's a big part of nursing is agility and adaptation and knowing where you're needed and knowing how to pick up skills quickly. So our nurses that work in enhanced critical care all experienced ICU nurses. So they come, with a really strong skill set, and they also rotate back into the practice, which is different than a lot of ICU programs. So, they could work Monday, Tuesday here in the core, and then Wednesday they could be back on one of our intensive care units. So that's really keeping their skills up to date. So we keep that portion up to date there. But when they first come into the core, it's a little overwhelming. There's a lot of pop-ups and different things going on that you need to pay attention to. But I think it's kind of like a charge nurse, or kind of the helicopter view. You're allowing that team on the floor to provide care to the patient, and you're just here as a support system for them and just in the background. And I think that really played to our strengths during COVID. We were able to deploy tablets. We work with Erica's group in connected care and able to pull tablets. We had them in a lot of our critical access hospitals, and we could deploy just a simple iPad tablet, and the nurse in the room could say, hey, can you connect to this tablet? I don't think this patient's doing well. Or, hey, can you connect to this tablet? Because I just have a question and I want to bounce it off of you. So we're able to share our skills at different levels and also learn a lot about their practices. I think what Erica's talking about, like learning from each other, is just an incredible asset that we have. And I think it's special at Mayo Clinic that we're able to always be open to that and always be learning from each other. So during COVID, we supported Florida, we supported a hospital in New York, and that went live in about 4 days. They stood up that program. So it was pretty remarkable what we can do when we set our minds to it, and those barriers are a little bit lower than normal.
Excellent. So you were able to stand up a new center in 4 days.
Yep.
And did you send tablets to that area, or do they have other ways to connect with your team?
Yeah, so they had other technology available on their site, and we just needed to develop the interfaces. So Enhanced Critical Care as a full-time IT team who, God bless these people, they are the backbone. They don't get enough credit for all the work that they do with, making sure that I can see their bedside monitor and making sure that data is coming in a timely manner, connecting outside of the Mayo firewall and outside of the into the other institution inside their firewall, so we can read their EHR. So yeah, having that group is just critical.
Excellent. And Erica, you mentioned your team really expanded through the COVID pandemic here this last year. And I myself know that we had a nurse on my floor here that actually had COVID and was connected with you guys and just gushed about how grateful she was to know she was at home, to be able to check her O2 sats, to get that phone call from a nurse on a daily basis, just checking in to say, are you okay? Yep. Okay, we're going to continue to observe and we'll check in again tomorrow. And then she would take her vital signs again. Can you tell me a little bit more about what your team was doing for patients across Minnesota through the pandemic?
Yeah, thanks, Tony. So COVID, just like everyone else, it shook us up this year, turned our world upside down. We had focused prior on chronic condition management, our heart failure patients, hypertension, COPD, really supporting the primary care clinics and a little bit of some of the specialty care clinics. Then COVID hit, and we're not looking at a chronic type of condition anymore. We are looking at an acutely sick patient. We were tasked with monitoring the high risk for complications with COVID patients, and we took our responsibility very seriously. We got to work very quickly, as I mentioned, training nurses. Bree, to your point for IT, they were getting our nurses computers to be able to work. It was those folks had to have been working around the clock. So yeah, shout out to IT. They enabled us to do our work as well. And again, the shout out goes to so many groups because that's the collaboration at Mayo. It's everyone working together for these common goals and, getting resources and support to those that are supporting COVID patients and having to start up their programs rapidly and implement. So really, we shifted that focus to more of an acute patient and a high touch patient. So we had these patients testing vital signs more frequently, which means that, we're going to look for a window of instability. A lot of times it was between day 8 and 11. And we're looking for those cues in their vital signs. We're also asking them symptom questions through that iPad and that tablet that they have that then alerts the nurse that there's an issue, they're getting worse, they have new symptoms. And then the nurse calls and does that symptom assessment. So much critical thinking goes into a telephone assessment to assessing the data that the patient is giving you for trends. A big focus with the COVID program was to catch things before it went downhill. Our program was trying to catch things early because what we found was that it decreased hospitalizations, it decreased length of stay in the hospital if they were hospitalized, and really the focus was catching any kind of decline as soon as we possibly could. So, but the other thing that we were able to do was to decrease length of hospital stays for patients. Specifically, they had looked into cancer patients' admission rates. So a patient who was not on our program typically had about an 11% hospital admission rate. The cancer patients that were enrolled in remote patient monitoring only had a 3.1% hospitalization rate. And I attribute that to the great
Wow.
nursing care that we were able to provide and the support that we had to do that.
Wow. And
That's
so
fantastic.
you mentioned that 8 to 11 day mark. You also mentioned the cancer patient group. So are the nurses in remote patient monitor also doing a lot of quality improvement work and really changing practices through some of the technology or some of the data that you're gathering through the technology?
Yeah, great point and great question, because the nurse at the bedside, so to speak, but I'll say more at the technology side of things, patient care, we are poised to identify those improvements, innovate, tell the team what we're seeing, make suggestions for improvement. And remote patient monitoring does an amazing job of collecting data. Every change we were making, every improvement that we're making, we had a team, speaking for nursing support. We have an amazing clinical nurse specialist. We have a nurse education specialist, our nurse manager, our nurse administrator, and then we have an entire team operationally and of supportive folks in connected care that we were focused on patient outcomes. And you need data to prove what has improved something and what didn't make a difference, and really focusing on that improvement.
Wonderful. Thank you for all your work. And as you both said, we want to just continue to acknowledge the phenomenal teams around us that are allowing nurses to take this on. Mayo Clinic has really prided itself on putting the needs of the patient first, and the Department of Nursing builds this through a healing relationship between the nurse and the patient. It seems like technology is really bolstering that relationship as opposed to hindering that relationship. Bree, maybe can you talk about how are your nurses building relationships either with the patient or with the other nurses that they're helping on the ground?
Yeah, sure. Yeah, it's interesting because our patients are, we're kind of one nurse removed from our patients and one team removed for our patients, but we still can feel the difference that we make when we call in and we talk to that patient. And we may be the only person they've seen all day. If there's only one of us in the core, we could take our mask off and, they're the only person they've seen their whole face all day long. And the other thing that we can do is give that nurse at the bedside a little bit of breathing room, a little bit of a break. We can be in on the tablet watching their patient for them while they go out and just get a break from their PPE, just take a minute, just because they were just under such incredible distress during this time. I think it was a really tough time to be in healthcare emotionally. And if I could just share one of the best stories we had is we previously had some barriers financially to supporting one of our critical access hospitals. And, once those barriers are dropped, we were able to be in there supporting them every day. And the nurse manager, when we offered our support, just cried. She's like, thank you. There's somebody here that has my back. And I think, having that nurse to nurse support will only enable the nurses at the bedside to provide better care.
Excellent. What a great way, like you said, to elevate the practice throughout and to be able to support those nurses and also support your nurses.
Yep.
And Erica, what about your team? Do you think of different things that we're doing to elevate practice for your nurses right now?
Yeah, and one thing with the technology that I really want everyone to know is that technology is here to support our nursing practice, but it does not replace us. So that is such a huge takeaway from, I think, this session with Bree and I, that I know that she wants everyone to know too, is that technology is here to elevate us, to make us better, to supplement the ways that we're able to care for patients, but it's not to take away our nursing judgment, our complex thinking, our critical thinking. And, we are just going to go to so many different heights when we use technology in that way. And our team has been in that space and that way of transforming healthcare.
Excellent. All right, well, I'm being told it's time for us to move forward with some questions. So thank you, Bree and Erica, for everything that you shared about your practice. It looks like the first question that is coming up here are, what are some things for new graduate nursing students interested in working at Mayo Clinic to consider? And so Bree or Erica, do either of your areas take on new graduate nurses?
Yeah, I'll speak for remote patient monitoring, and definitely. So we can look at new grad patient or as students. You know, one thing that I would say to any new grad is keep an open mind coming out of nursing school. So I'll tell you, 19 years ago when I came out of nursing school, never did I imagine I would be in the position that I was in today. I can't even tell you what nursing will look like in another 20 years. So focusing on what can that learning opportunity be for you in whatever that first job is. But there are more and more areas in telehealth popping up. There are areas taking new grads. Remote patient monitoring we are quickly growing. We are quickly expanding, supporting even more practices. So you know, just really come in with that continuous improvement and learning mentality.
Excellent. And Bree, do you have any other advice for a new nursing grad looking for their first job?
Boy, Erica, I think you hit the nail on the head. You know, just like there's a lid for every pot, there is a patient for every nurse, right? I didn't come into nursing being the most caring and loving and compassionate stereotypical nurse. I loved the science of nursing. I loved the medicine of nursing, and so it's important to realize that every nurse will have their strengths. And just because I'm not the nurse that, you know, maybe is going to be huggy and kissy, but by gosh, you're going to get better. So, you know, I think just finding where your tribe is in nursing is important, and keeping that open mind to finding it. I've been in 18 years, I've been in 6 different areas, and I think you only get better by trying those new things.
Yeah, and I would say the same thing. We, of the three of us here, I think my unit has the privilege of hiring the most young nurses. And so,
Yep.
Abe, thank you for the question. I would say exactly what Erica said. Stay open. Know that there are multiple different areas of nursing. Like Bree said, there is a fit for everyone, and that is the beauty of nursing. Whether it's compassionate care through a end of life situation, whether it's the high technology of the EIC or the ICU, some of the adventure that's associated with some of our research departments, or somewhere in between. So ask lots of questions, enjoy your time at the bedside and taking care of patients, because there will be more and more challenges. So
Absolutely.
Get out there, take some challenges and have fun, because it is a phenomenal profession. Looks like we have another question here. What other areas are technology being used in? I don't know if one of you wants that. Otherwise, I'm
Sure.
happy to go.
I would say, where is technology not being used? I mean, we're even using what we call a Visi monitor, which is probably quite similar to what Erica is using on patients on our general care floors. Every day that technology is evolving. We're using technology in how we staff nurses. I think we're more and more, you know, the model of staffing from 1978 is changing. And so the technology for, you know, creating those algorithms of, you know, what's the right nurse to patient ratio, what's the best way to staff a unit, what's the most efficient thing. So I think having all of the support systems, they're all using new programs to help us do our jobs.
Excellent. Erica, anything to add?
Yeah, I would just add that technology is used, you know, Bree and I have really talked about those high risk patients and the critically ill patient, but technology is being used even for low risk patients. So our patients, today's patient wants to connect with their care team on their schedule, on their watch when it's convenient for them. So interactive care plan within Connected Care is another tool that we use use and technology where patients can connect through their smartphone to their care team, and it's kind of on their terms, but it's also guides them through ways to care for themselves. COVID-19 was a big program that we had with the interactive care plan as well.
Excellent.
Yeah. What is it? What is it? The patient will see you now. I mean, that's kind of, you know, the system that we're working towards, and I think it's a wonderful way to focus.
And I think another area that I think of now with technology supporting is the technology we're using. Well, like we're doing right now, we're all on Facebook Live, sitting in our own offices. And that's been a huge support to all of the staff. I think of the new graduates that are coming in, and they no longer have to be in a classroom for half of their orientation. They can watch high fidelity orientation videos. They can learn more about the physiology from home. Like you said, Bree, they can check their schedule from home, which is something that I don't think any of us would have imagined doing 20 years ago.
No.
And so, and just the number of meetings we've had, the way the Mayo Nursing Council can help advance nursing practice, all of them from their own place. They don't have to drive in for a 1-hour meeting. They can Zoom or do those meetings too. And it's really given a voice. I think of Slido as well as another question and answer session that allows every nurse to bring forward their voice and really elevate their voice to help advance the practice.
Absolutely. You know, we're connecting with our CNO weekly. I mean, that's amazing. I never would have thought that would have happened early in my career.
Excellent. So it looks like I'm being told we have time for one more question. So can each of you share one other group that you're working with to advance innovation at Mayo Clinic?
Yeah, I think I'll start to just build off of what you had mentioned with Mayo Nursing Council, Tony. So Mayo Nursing Council is such a unique council to Mayo Clinic. We have division representatives from each division of nursing, and all of those representatives come together to collaborate and talk about those innovative solutions that their areas have found and are using. Rhiannon Frederick, our CNO, comes and updates the Mayo Nursing Council monthly. It's an amazing time to just bring that bi-directional communication where upper leadership is directly listening to what each unit is communicating through their division rep. So that is something so unique to Mayo, and I think it just really shows how valued, again, that staff nurse perspective is, and our support for innovation. So that's one group that we very heavily collaborate with, and Mayo Nursing Council is supporting innovation throughout all the divisions.
Excellent. And Bree, one other team that you're collaborating with right now for innovation.
Sure. Yeah, sure. So we're actually really closely involved with an acute multi-patient viewer program. So it's actually a brand new program that kind of helps synthesize data from the medical record and sniff out, using artificial intelligence, you know, patients who are at risk for deterioration in the next hour, patients who are more prone to a hospital-acquired infection. So giving us those little snippets from the medical record it's really amazing that we can data mine that much out of our EMR. And what's great is that group is listening. It's listening to everyone. It's listening to the respiratory therapists. It's listening to the physicians. It's listening to our advanced practice providers. And not just as a nurse manager, but also our staff nurses. They can hit a button and they can submit a suggestion to that program group to say, here's what I need. Here's what we need as a bedside team. Here's the tools that I need. So having those close connections and having these homegrown things it's an incredible asset.
Excellent. Thank you, Bree. And I think that really encapsulates everything that technology and kind of healthcare at Mayo Clinic is all about. You know, we're using technology to really drive through that innovative multi-specialty clinical practice and help nurses and physicians and physical therapists and everyone work as one team to come around the patient and put the patient at the center of need. And then using technology for all of those individuals to get to take care of that patient and really elevate practice. So I'm hearing that it's time to wrap up. So I want to thank everybody for joining us today. If you enjoyed this, please hit that like button below, as well as we will be doing another one of these events on Tuesday, May 18th. So if there's a area of nursing practice that you would like to hear about from Mayo Clinic, please put your recommendations down below. We would love to hear from you, and we would love to connect with you again on May 18th as we do another Facebook Live event from Mayo Clinic Nursing. Have a wonderful day.